This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. We're all readjusting now that coronavirus is spreading around the country. Now, how will lawmakers in Washington handle this pandemic and the impacts it will have on our daily lives, our children, our economy? Today, Where We Live, 1st District Congressman John Larson joins us remotely to answer our questions and yours. Here's the number to call in, 888-720-9677. That's 888-720-WNPR. As always, you can find us on Facebook and Twitter. Just search Where We Live and add your question there. I want to welcome Congressman John Larson to the show. Again, he's joining us via Zoom. Congressman Larson, happy St. Patty's Day.
Happy St. Patrick's Day to you, lass.
Now, I can't see you. Are you wearing green?
Of course I'm wearing green. You know, Colin McEnroe would have it no other way.
Well, before we start talking about what you're working on as a congressman, I mentioned how all of us are readjusting our routines, our daily lives. I want to know how the spread of coronavirus in the United States has impacted your life. What routines have you changed?
Just about everything, especially when you're in the business of governing and politics, which is socially intense. Essentially, most things that we normally would do have been canceled. And keeping social distance for people that are normally used to shaking hands and greeting people is a challenge in and of itself. But frankly, it's something that I hope everybody's observing.
Now, how did you travel back to Connecticut from D.C.? What precautions did you take, Congressman?
Well, the same thing. You know, we traveled by plane, and actually the airlines were very good about it in terms of talking about, I really didn't know that much about the air filters and what they do, but as it relates to the coronavirus and how it spread with droplets, it's actually the air within an airplane. If you direct it down, and as long as you're sanitizing your hands and you have wipes and you wipe things off around you, it was quite okay. I would note that coming back from Washington, the plane was not very filled. So, and the airport was sparsely populated. And that was just this past Saturday.
I understand your offices are no longer taking constituent visits, but what are you hearing from your constituents about COVID-19? What are you telling them?
Well, actually, what we've done is we had the second of our teletown halls, and we had close to 3,000 people on the call yesterday. Now, we were able to take about 20 or so questions in the almost 2 hours that we were on the phone, but they're pretty common sense questions. They want to know about vaccines. They want to know about how long it will last, what impact it's going to have with school closings. How will the paid leave bill work? How operational it is, and what else Congress intends to do. And it also provided us an opportunity to just reiterate what the CDC has recommended. That's the Center for Disease Control. And Dr. Fauci also, and what he has been saying repeatedly. And I think people they were very courteous, and people, I think, found it helpful. This is true of the entire delegation. I believe Joe Courtney's doing a town hall today, Rosa DeLauro on Wednesday. I know Johanna Hayes is planning to do one, as well as Jim Hines. And as you're probably aware, Chris Murphy and Dick Blumenthal are in Washington, hopefully passing the legislation that we adopted on Saturday.
And before we talk about the Families First Coronavirus Response Act, I do want to open up the lines to our listeners who have questions, again, for Congressman John Larson, a longtime member of Connecticut's congressional delegation. He represents the 1st District. You can join us, 888-720-9677, or again, find us on Facebook and Twitter at Where We Live. Again, Congressman Larson is joining us via Zoom today, remotely. We're trying to do our best with social distancing, even as a live call-in talk show, trying to get our guests to join remotely. Mark is calling from Oakville. Mark, you're on the show.
Hi, can you hear me?
Yes, go ahead, Mark.
Yes, it can.
All right, thank you. Thank you for taking my call. Yeah, this is Mark. So my kid's out of school for 2 weeks. We're fine. We can handle that. We've got food. We've got money. We can sustain ourselves. The president says that this could go on until August. We're okay. I've got food. We're resourceful. I think a majority of Americans or people are not going to be able to sustain themselves until August. They're going to run out of money. The unemployment system, if every single person in Connecticut were to file, would be completely overwhelmed. So that people are not going to get unemployment. People are going to run out of money. Then they're going to run out of food. And when people run out of food, I think things are going to get really, really potentially dicey. And throwing money at the markets is not going to help a family of four put food on the table. What the government needs to do, and they need to do this unequivocally and immediately, is cut checks for every family of four. Makes a certain amount of money, they get $5,000. Other family get $4,000. So I don't know. But giving money to the markets so that they can piss it away, gambling on us is completely irresponsible and lacks all kinds of leadership, and just shows that democracy in this country really works for you if you're rich. I'll take the comments off the air.
All right,
Thank you.
Mark, thank you for calling in. Congressman John Larson, so many people worried about what coronavirus will be doing to our economy, not only across this country, but in our local communities. What can you tell Mark about how you're thinking about this and what the Congress should do?
First of all, I thank him for his opinion, and I'm glad to hear that he and his family are going to be fine. Let us hope. And I think finally the president has gone from the position where this wasn't going to happen and could be gone in a couple of weeks to listening to the healthcare professionals and the scientists, and also being able to observe what's going on around the globe. This is a global pandemic, and clearly it's going to present its challenges. But this is a time when we need to turn to government and work together, and especially even with some of the concerns about the immediate reaction of the administration that has been voiced by a number of us, including the entire Connecticut delegation, with respect to the timeliness of the response. It's now up to all of us to focus on what we have to do in the most preventative way that we can to minimize the impact of this and make sure that we're doing what people need to make them safe and secure as we go through this process.
What do you think about the president's stimulus, $850 billion package to counter economic fallout? Can that help people like Mark in Oakville?
Well, Mark sounds like he's going to be okay, but what we have to do is help people in general. I think the first thing we have to do is take it, and what we did with the legislation is focus on people, both in terms of people that will be immediately impacted by layoffs, or furloughs, depending upon what sectors of the economy that they're in. When you close, your theaters, when you close, and even if not many tears are shed when you close professional basketball or Major League Baseball or the National Hockey League, but all the vendors and all the people that work in those venues, and everybody, from parking attendants to vendors that supply these things, the airports, people that are displaced because, as in Mark's situation, you have young kids and they're going to be home. This is going to create change, but it's change, I think, that is necessary and required. I want to compliment the governor of the state of Connecticut for acting in both a very timely and decisive fashion everything that we hear from the scientists and the people at the CDC is the reason that we talk so much about social distancing is the way to prevent the exponential spreading of this disease is to have less contact, especially in densely populated areas and with people where willingly or unwillingly you may be spreading this virus. And so to limit that impact early will help us in terms of shortening the duration and length of this virus.
Congressman, can we talk about the coronavirus? Again, this Families First Coronavirus Response Act. The House passed it on Saturday. It's now before the Senate, I believe. So talking specifically about working class families, what are some of the things in this act that can help them?
Well, the first thing is that every family, once anyone comes down with the symptoms, the most important thing is that they get tested. And so the first thing that was accomplished is that testing will be made available to everyone, whether you have insurance or don't have insurance, whether you have a copay or not, the testing is free. And anyone who comes down with the symptoms should, A, contact their doctor or health professional first. If you don't have one, then in Connecticut, you should call 211. And that number, at that number, you will get the assistance and they will walk you through what you should do and then go get tested. So testing is the most important thing, and that's free. We also passed paid family and medical leave. It's temporary, but nonetheless, especially for people with 500 or fewer employees, and that's a number of people here in the state of Connecticut will now be able to, and their employers will be compensated for it, will all be able to take sick leave, or if they themselves contract the virus, or they have to take care of someone at home, or in the case of school closures, if you have young children, et cetera, and all the stresses that this is placing on society currently.
And unemployment benefits, Congressman?
Yes, unemployment benefits are going to be enhanced, and those monies will go back to the states. And not all sectors are going to be laid off. And Mark painted a very foreboding picture, but let us hope that we get out front of this and manage it and utilize telecommunication to help out and work from home, et cetera, and be as least disruptive as we possibly can. And it's going to be a combination of several things, including we've had two tranches of legislation, one where we passed $800 billion of money that's going back to the states, primarily $3.4 billion for public health and social services, $1.9 billion for the Center for Disease Control, $900 million for research at the National Institute for Health, $20 million for the Small Business Administration for loans. And we heard a lot of questions about loans in my businesses, both yesterday on the line and calls that we're taking. I'm meeting with business people in the district later on as well. And we also passed last week the paid leave, as I mentioned, as well.
Congressman John Larson, I wanted to open up our lines again to our listeners who have questions for you. Congressman John Larson, representing Connecticut's 1st Congressional District, the number 888-720-9677. Sue is calling from Newtown. Sue, you're on the show.
Hi, how are you guys? Thanks for taking my call.
Good.
Good. My question was, is there any kind of legislation or effort to help with some temporary funding or support for artists, performing artists specifically? It hits home personally because our 27-year-old son is a professional jazz bass player in Manhattan, and I'm going to go pick him up on Friday and bring him home because he has no gigs. Everything's canceled. all the clubs and stuff, of course, are closed. But this is widespread. It's not just, jazz bass players. It's dancers and all the Broadway artists and all the scenic artists that are behind the scene, anybody in the gig economy. Obviously families need support too, but these individual artists need help. So I'm just wondering if there's anything in the offing that could help these folks.
Thank you, Sue, for your call, and hopefully you can connect with our producer. We are hoping to do a show on the gig economy on Friday. But Congressman Larson, your thoughts?
She's absolutely right. And we've heard from people right here in Hartford, and whether people are at the Athenaeum or people are employed in the entertainment business, whether you work in a museum or whatever, or you're part of the arts community. Yes, the money that will be made available, both in terms of unemployment and that is going back to the states, will impact them as well. And so we're also looking at another tranche of money that we hope to provide for further economic stimulus and development, investment in infrastructure, and also, quite frankly, for the most vulnerable among us, which are the elderly. We're looking to, I'm initiating a bill to expand Social Security in the short term. I think it should be done in the long term as well. We believe this of family and medical leave as well. But all these questions, by the way, Lucy, are very helpful too, because it will help us as we go back to Washington and try to provide the policymakers with other concepts and ideas. But if you're let go or furloughed without pay due to any of the economic impacts due to the coronavirus, you're eligible for unemployment benefits. And so that would be the case with, I believe she said it was her son she was picking up.
Yes, that's right. You can join our conversation, 888-720-9677, with Congressman John Larson, who's joining us remotely from his office. Bill's calling from Middletown. Bill, you have a question related to what we're talking about, this Families First bill that the House has passed, is now before the Senate to help small business owners?
Yeah, how you doing?
Okay.
Good.
As a small business owner, I haven't heard anything about how the employer would go about, I have employees, and if they have to stay home for being sick or were forced to close or what have you, how do I go about, applying for this money or getting reimbursed or whatever? And also the Small Business Administration loans, is that done through a bank or directly through the government? How's that?
It's going to come through the Small Business Administration in conjunction with the state. But your question is very timely. It's operational. And while we're talking about a bill that was passed, it is not operational yet, meaning that it hasn't passed the Senate and been signed into law and then go through the various agencies. But the timeliness of this is to try to speed up the process as quickly as we possibly can, so that small business owners like yourself will be able to direct both their employees and you as an employer to either take advantage of the small business loans. There's another proposal out there to also talk about direct grants or cash. A number of these issues are going to have to continue to be debated. There was quite a bit of resistance in Washington to doing much of anything, but I think fortunately now people realize that this is dramatic and it's upon us, and it's timely that we act as quickly as we possibly can to get out with the relief that we can for people in every segment of the economy.
Do you anticipate the Senate voting this week, Congressman?
Yes, we do anticipate them voting.
You can join our conversation with Congressman John Larson, the number 888-720-9677, or find us on Facebook and Twitter at Where We Live. I'm Lucy Nalpathanchel. We're going to continue our conversation after the break. We're also going to ask Congressman Larson how Congress will be able to continue to do its job, because as well, social distancing is important for them as well as us in terms of separating yourselves from people to avoid getting sick. So how does Congress continue to do its work if members of Congress are also falling ill? We're going to find out more after the break. You can join us too. 888-720-9677. This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. My guest today, Congressman John Larson. He's represented Connecticut's 1st congressional district since 1999. He's joining us today via Zoom. What question do you have for him, especially as our country works to slow the spread of coronavirus in communities? The number 888-720-9677. That's 888-720-WNPR. Or find us on Facebook and Twitter at Where We Live. Sean's calling from Hartford. Sean, what's your question?
Yes, thank you, Lucy and Senator. My question is, if we just look at the facts being that over the last years and decades going back, in America alone, 12 to 61,000 people have died of the flu. Again, in America alone, 12 to 61,000 people have died from the flu. Worldwide, 646,000 people have died of the flu, for which we have a vaccine for. That's worldwide in years going back. And as we speak today, only 6,500 people have died of this corona flu as we speak right now. Why are we going in this panic? Please explain that to me. Why are the media not telling us the full truth about this?
Well, Sean, thank you for your question. It's something that I know other people are considering. We are listening to public health experts, scientists, and researchers who are telling us that this is dangerous to our community. We don't have the antibodies for this coronavirus. And Congressman Larson, maybe you could speak more about the fact that we hear so often about why it's important to socially distance, to keep this spread from rapidly coming to our communities, overloading our hospitals. I think the other day there was talk that there is the Danbury Hospital on the western side of our state is at capacity. Can you address Sean's point that he's trying to make?
Yeah. And first of all, let me say we get that question frequently. And I would say, number one, thankfully, the media is on top of this. And I share his concern because sometimes you can feel that an issue is blown out of proportion in terms of how we're dealing with it. But as you pointed out, Lucy, the problem here is with the flu and other issues. We have vaccines and we have antibodies to deal with them. The last time that we had something close to this was Ebola, which certainly was very alarming and concerning. It's my sincere hope, and I'm always very optimistic that once America directs its full attention to this issue, and with our labs and with our industry, with our scientists, we're going to be able to get our arms around this. And while they're saying it may take a year to 18 months to develop an effective vaccine, they think that they're already having success with some of the remedies that they're looking at for people who contract the coronavirus. What we're most concerned about is that the way that this spreads itself exponentially, and the way it happens, and why crowds are conducive. And this is what they found out in China, and this is what they're learning painfully in Italy. And to just put this in perspective, and I know the caller was perhaps frustrated. But what's happened on the today is St. Patrick's Day. There was many closings of parades and social gatherings, etc. But the holy day in Christianity is Easter. And the Pope announced in Italy that while they would have Mass via television in St. Peter's Square, that it would not be open to the public for the first time in its history. And the reason is because of what the scientists are telling us in terms of how the spread takes place. And Lucy pointed out, and we can't underscore this question enough, what we don't want to have happen is hospitals to become overwhelmed, and not only they become overwhelmed, but also their personnel, the people that are on the front lines of this, the healthcare providers. I don't know whether the listener saw the 60 Minutes special that was on the other evening when they talked about what's going on just across the border in New Rochelle in New York and how people are dealing with this. Look, we're a resilient people, and yes, we will get through this. And yes, I believe that our scientists and all the healthcare professionals and dedicated labs that we have and the pharmaceutical industry will ultimately come up with a solution. But it's been elusive. We haven't seen anything like this. We don't have it. And so therefore, the extra precaution, and especially for people who are elderly, but it's also susceptible to people whose immune systems have been compromised for whatever the reason, whether it be a chronic disease, whether you're young or old, whether, for example, you were going through chemotherapy. There are a host of things that healthcare advisors and Dr. Fauci and others have been advising us to do. Now, the nation is also, since I've been in Congress, we've been through September the 11th. And yes, we've been through the Great Recession of 2008 and 2009, where the stock market and nearly collapsed completely. Those are crises. So is this. And it has to be taken seriously because of the way that this virus spreads itself. And without a remedy, and specific effective remedy right now, or vaccines, that's what's created the alarm. So this is the best way to deal with this. And let us hope that through programs like NPR and we're going to be able to get as much information out to individuals, and then they act on it the way that they should. And hopefully they're following the recommendations of the Center for Disease Control. But this is not some hysterical thing that's being perpetrated by the media. This disease and its impact are real. You only have to look to Europe if you don't believe what's going on in China, and to recognize that there is going to continue to be an exponential growth of this. The way to stop that, the way to minimize it, is to do all of the social distancing recommendations that have come forward from the CDC.
You can join our conversation. You're hearing Congressman John Larson here on Where We Live. The number 888-720-9677. Maria is calling from Middletown. Maria, you're on the show.
Hi, Congressman. It's good to hear you, and I want you to know that I appreciate everything you've done for the state of Connecticut. I have a comment about current I just have a comment about airports and the TSA. I've seen some pictures of people getting off planes and being packed into airports. And it just seems to me that something should be done about it, and it should have been done sooner. And I want to know if the airports are privately run, if the TSA is staffed up, if anybody is looking at this, because I know domestic flights are still continuing. And maybe you had a good experience at Dulles, but Chicago, those poor people waited 4 hours or 6 hours in line, and they were packed into the airport, and they weren't screened. And talk about community spread. It's probably all over the country by now, just from that one incident.
Thank you, Maria. Thank you. Go ahead, Congressman John Larson.
Well, again, Maria, it's a great question. And to your point, yet was the nation prepared for this? The short answer is no. And even though there were calls by a number of us, and let me commend Rosa DeLauro, Jim Hines, and others of the Connecticut delegation, Joe Courtney and Johanna Hayes, that were leading the effort with the administration to say, look, we've got to get on top of this. And with the calls for us for all Americans that were abroad, as we were canceling trips to Europe, et cetera, first with China, South Korea, Japan, et cetera. But then with Europe, that meant that citizens were scrambling to get back home as soon as they could. This, as you point out, I was at National Airport, not Dulles, but this created problems because the points of entry that they could come back to were limited. They were limited because they wanted to make sure that they were doing the appropriate screening. Surely it could have been done better. Surely TSA, and let's give these government employees a little shout out here too, who again are also on the front line and have to go through all of this. And a point we should have made earlier, but I don't believe that we did, with regard to masks and gloves and precautions. Clearly, what your mother advised you early on was always the most important thing, to make sure that you wash your hands and with soap and water, and when absent that, using whatever form of Purell or hand sanitizers that you have available to you. Don't touch your face. Those are all the common sense, practical things. And what we're told, especially by CDC, is, and we've seen this run in supermarkets on everything from toilet paper to food, the supermarkets are going to remain open and well stocked. There's not a concern, and there's no need to panic here. And most of the masks and stuff that people have been purchasing are not effective with this virus. And we want to make sure that the money, focus, and effort goes to our first responders and our frontline healthcare professionals. So as they go out and assist our community, they're taken care of.
Congressman John Larson, I just wanted, before we take some more calls,
sure.
Earlier I had posed the question how Congress continues to do its job as members also try to keep from getting sick. There are, I believe, Politico reported that this Congress is one of the oldest Congresses in terms of average age. So what is the plan as you travel back and forth? You have jobs to do as well, but your health could also be compromised.
Well, yes, but we have a responsibility too. And I just mentioned the 60 Minutes special that was on the other night, where healthcare professionals were going to the doors of people that have been isolated and have to perform the testing. And they do so knowing that they're going into harm's way, the people that come to the emergency room. And again, we can't emphasize enough, Lucy, that you should call your doctor, your healthcare professional, and absent that, call 211 and get the kind of direction if you have those symptoms.
But what about Congress, Congressman Larson?
Well, Congress is, we have the attending physician's office in Congress that instructs us. We get daily briefings, but now the precautions are to stop the visits, to start doing for the staffs, first and foremost, that they're able to do teleconferencing and work from home, and that we continue to try to utilize social distancing ourselves. But the point I was getting to is this: we have a responsibility to vote. And so we have a responsibility to get there. There isn't yet a remedy in the Constitution for voting while you're not in distance voting. Not that couldn't be achieved. And it's something that Congress is going to have to look into and study in the event. And this was discussed, frankly, after September the 11th, when Washington, D.C. itself was a target by terrorists. In this case, with the virus, everyone's the target. And members have got to do everything they can to follow the healthcare advice that the CDC provides us. Limit exposure, do as much as you can with regard to social distancing, do teletown halls instead of actually doing town hall forums, as we typically would do in the 1st Congressional District, and then meet with your constituents via the phone and get information so that you can turn that into a policy. But anecdotal evidence about, hey, I was at this airport and the crowds were long, all these people came in, what's being done about that? This information is taken back to Washington. Things are being done currently. Were they ready for this onslaught? Short answer, no. Will we be ready in the future? Let us hope so, because that's where we need to put our money. That's where we need to put our effort. That's what we have to do to try to continue to protect people who will still have to work, who will still have to travel, and still find themselves in harm's way with this virus. And so while we're waiting for the vaccine, while we're looking at the remedies, let us continue to practice in a common sense manner all the recommendations of the CDC, and let Congress work on the relief packages. I should have mentioned also, Lucy, at the outset that we also, aside from providing paid sick leave and paid family and medical leave for workers employed by small and medium-sized businesses, it also provided $1 billion for food assistance program. And this is important, including providing foods for low-income and pregnant women and mothers with young children, and assistance to local food banks and home-delivered meals to seniors. It also gave the states the resources and the flexibility to provide unemployment aid to people laid off or furloughed due to the coronavirus.
Well, Congressman Larson, again, that bill still needs to be passed by the U.S. Senate. You said earlier that it may happen this week. I want to take one more call before we head to break. Anthony's calling from Bethany. Anthony, what's your question?
Hi. I was just curious if there are any plans in the future to suspend mortgage payments, as other countries are currently doing, to help those affected by job loss or loss of hours.
All of these issues are currently being discussed. I would also add that Joe Courtney has a bill, and this came up yesterday in our phone calls, Lucy, with interest rates, with the Fed lowering them now to zero. Joe Courtney and the Education Committee have put forward a bill that essentially would allow all people to take their student loans and refinance them so that they would be like a 2% across the board student loan. This would be a tremendous asset. The Connecticut Judicial Branch has also suspended all eviction and foreclosure hearings for the next 2 weeks. In addition, Connecticut Public Utilities Authority has ordered gas, electric, and water and public service companies it regulates to implement a shut-off moratorium and refrain from terminating utility service to residential customers, except for reasons of public safety, for a 30-day period subject to renewal, to ensure all residents may safely remain in their home during this epidemic as well. But the question on mortgages, et cetera, is one that the Finance Committee is also deliberating on in Congress as well.
You're hearing Congressman John Larson again joining us via Zoom today here on Where We Live. I'm Lucy Nalpathanchel. He represents the 1st Congressional District. We're going to continue our conversation right after the break. You can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. As coronavirus cases increase, so does our stress. On the next Where We Live, that's Thursday, we're going to talk about anxiety and how this is affecting our mental health. What are you doing to treat yourself during this crisis? How are you talking about it with your kids? That conversation on Thursday. Today with me joining via Zoom is Congressman John Larson. He represents Connecticut's 1st Congressional District. Dan's calling from Willimantic. Dan, what's your question?
Hi, thank you. And hi, Congressman. This is actually a good lead-in, speaking with mental health. I have a question regarding nonprofits who I think are in a particularly tough place at the moment.
Sure.
We can't stop serving services to the most vulnerable folks at this time, and we also have no way to raise prices or make up lost income or anything like that because of the nature of the business. What's being done to offset losses and avoid negative impacts on employees and folks we're serving?
Well, the same issues as they relate to both small business loans and with respect to unemployment and people being furloughed and paid family and medical leave would also apply to not-for-profits.
Janelle's calling from Danbury. Janelle, what's your question?
Hi, thank you for speaking today with us about these issues. I was wondering, because I have not heard anyone speak about this, I'm concerned and wanted to know about taxes, especially since they're due in less than a month, and my financial concern with regard to my tax returns. If people owe money, is that being addressed at all?
Thank you, Janelle.
I assume you mean if you don't have the money to pay your taxes. I would assume that. But
is there any? I'm not familiar with this, but has the IRS, are they able to change the deadline of April 15th?
Well, I don't know whether or not that has been discussed at this particular a point, but of course those were for the taxes that were levied in the past year, and it's a great question. I don't know that the IRS has taken any specific plans to do that, but that's something we should definitely look into.
Congressman, we just have a few minutes left. Again, President Trump has expressed this interest in having a payroll tax cut to attempt to boost the economy in the face of this pandemic. I understand this money that goes into the Social Security Fund. I mean, what is your response to this idea, considering you've been pushing a proposal to bolster Social Security?
Well, that's what we think ought to be done. We think that rather than depleting the fund, and yet, again, we started this whole thing off with someone saying, why are we sending more money to people and reducing taxes of corporations that isn't going to have a direct impact? And the most vulnerable population in this for the coronavirus are people, and it grows higher from age 60 to 70, and then from 70 and 80 and above. Those are, in fact, the most vulnerable people. And I believe that what we need to do is get money into their hands, because that's money that helps stimulate the economy, and they spend it exactly in the places that you want them to, at their local pharmacy, at their food store, at their cleaners, heating and cooling their home, and doing the essential necessities that they're going to need. And so, yes, I think it was unanimously resisted by Democrats in the House and in the Senate, and frankly, bipartisanly. I think a number of Republicans also recognized that while having a holiday, as was done during the Obama administration, could act as some kind of stimulus, a better stimulus given the nature of this virus, given the targeted population that it hits, would be to send money directly to them. And we're going to be initiating legislation that will do just that as part of the third wave of packaging to get money into the hands of people that are most directly impacted by this.
Congressman John Larson, again, just a couple of minutes. Earlier you talked about this country will be able to be resilient in the face of this pandemic. A lot of frustration that there weren't enough tests to put out into communities so that health professionals could conclusively find out, if people have coronavirus. Right now, it's if people are sick enough to go to the hospital that they're able to be tested. What should be happening in the next couple of weeks? And frankly, is it too late now to get these tests out as more people, again, are socially distancing and just trying, if they get sick, to keep from spreading it to others?
No, in fact, it's even more imperative because, as you may have heard Speaker Pelosi say, and the focus of our legislation initially, and we heard this from every sector of the professional healthcare providers and scientists, still is testing, testing, testing. Social distancing and self-isolating and whatever is helpful. Not everybody is going to contract the disease, and some may be naturally immune to it. But we've got to have the testing capability to get our arms around the scope and to better assist with some of the remedies that we're going to have.
Learning from South Korea, they've been able to test.
They were able to do 10,000 a day, and now we're streamlining the process so that we're going to be able to do it. We should have, I thought, taken the effort from the World Health Organization, who also offered the administration its testing. It rejected those. There have been a number of mistakes, I believe, that have been made along the way, and there'll be ample time to hold people accountable and criticize that. But what I found, Lucy, quite frankly, is that in our conversations with people, they're less concerned about laying blame right now as they are about rolling up your sleeves and getting the job done on behalf of people. And that's got to be the focus in the short term. And then Congress always has a responsibility of oversight and review for what happened and what transpired. But now, in the midst of this crisis, let's all roll up our sleeves and pull together as this country traditionally does in a crisis, whether it was September 11th or the Great Crash or, frankly, the Great Depression, World War II, or any of the crises this country has been through.
This hour has gone quickly. Congressman John Larson, you're running for re-election. You've been serving the 1st Congressional District since 1999. I believe Betty Dang is running as a Republican in the GOP primary. We hope to have you back soon. Thanks again.
Well, Lucy, thank you. I look forward to coming back, and I enjoy it. What a great voice you have, too. A lot better than Colin McEnroe.
And I'm wearing green. I just want to point that out. Happy St. Patty's Day to you. Carmen Baskoff produced today's show. Thanks to Kat Pastor, our tech producer. I'm Lucy Nalpathanchel. We'll be back on Thursday.